Rahim, thank you for coming for this talk. Appreciate everybody taking time off on a busy bank holiday, nice weather outside. We'll try to keep this talk as about 30-35 minutes, try to do it as quickly as you can because I appreciate everybody wants to get on with the rest of the weekend. We will leave plenty of time for questions, so if you can try to leave a question till the end. If you have a really burning question, then you can interrupt us, not a problem. But you try to leave it at the end. We leave plenty of time for questions at the end. So my name is Kashif Aziz. I'm a GP in Sutton. I think a lot of you know me. And this is Brother Osman, who's a cardiologist at St. George's. So we'll be doing the presentation. I will do the first half, and then he'll do the second half, and then we'll do the questions together. Okay? So let's make a start without further ado. Just to work. Okay, so I'm just going to quickly gloss over a lot of things. So this is obviously the people. This presentation is mainly on, obviously it's fasting, but it's about Ramadan and fasting. There's a specific section on diabetes because that's the most important relevant bit when it comes to fasting. But we'll be covering other aspects of healthy eating in Ramadan as well. But a lot of this presentation to do with diabetes. So we got people who helped us out with the presentation. We are part of BIMA, which is British Islamic Medical Association. It is basically volunteer-led, and it basically provides education. Got 113 members who are doctors, pharmacists, dentists, and so on. So it's mainly for medical professions, but anybody who wants to join it who's not part of BIMA, you're welcome to join as well. Our mission is to inspire our members to unite in the service of our patients and profession. There's a quick disclaimer here, basically. So before I start anything, first point is here. You must consult your GP for any specific medical issues. We'll try to answer something later on, but try to consult your own GP if you have any specific questions with regards to your own medical issues. But we'll do the best we can anyway. With regards to issues about fiqh and scholar, please consult a scholar with regards to any specific Islamic issues of fasting. There are different schools of thought, obviously, on certain aspects of it. We are not scholars by any stretch of imagination. So if you have any specific questions about the scholarly aspect of it, you must consult your relevant sheikhs and imams at your masjid, because there are different schools of thought and we respect everything, basically. So objective of today is to basically learn about potential health benefits and risks of fasting, diabetes in Ramadan, and discuss a healthy diet plan as well. Okay, so why do we fast? I'm teaching you to suck eggs with this, obviously. I know most of people know that. Obviously, it's something which is part of our religion. The health benefits are secondary, and there are obviously other aspects when you can fast as well, other days which are recommended for fasting, Muharram, Rajab, Shawwal, Dhul Hajj, 13, 14, 15 days, Mondays and Fridays. This is not the health benefits of fasting. This, unfortunately, is the most important thing here. They did a study basically on fasting, mainly amongst Pakistanis, sadly, and they've shown that in Ramadan, instead of people losing weight, 35% of men actually gain weight in Ramadan, and 38% of women gain weight in Ramadan. So unfortunately, weight gain is more common in Ramadan than anything else because of what we eat, unfortunately, which is quite sad. Only about 12% people lose weight in Ramadan. So you can see that actually, unfortunately, that's not something which especially Asians are not very good at. As I said, the potential health benefits are secondary to obviously the religious aspect, but there's evidence that short piece of fasting, if properly controlled, you can achieve a number of health benefits as well as potentially helping the overweight. Fasting diets have become one of the most popular diets in the recent years, and obviously there are quite a lot of benefits with that. So there are certain diets. There's a diet by Dr. Michael Mosley, which is a 5 and 2 diet basically. So 5 days you eat normally a day, 5 days a week you eat normally, and then 2 days a week you reduce your calories to 500 calories if you're a man or 600 calories if you're a woman. And they've shown and studied a lot of health benefits with that. And that actually that fits in very well with the sunnah of the Prophet, peace be upon him. He used to fast on 2 days of the week, Mondays and Thursdays. So if you think about it, the 5 and 2 diet has actually medically been proven as well, that having significant health benefits. And the Prophet, peace be upon him, used to do that anyway when he used to fast on Mondays and Thursdays. So the health benefits of fasting is obviously potential benefit of weight loss, although we've shown in slides that's not always the case. Improvement in cholesterol, improvement in blood pressure control, blood glucose control in the majority, mental well-being, and obviously most important thing in my opinion is obviously addiction like smoking and other activity, which obviously is not good for you anyway. In Ramadan, it's amazing how everybody who can smoke, they say they can't give up smoking, but when it comes to Ramadan, everybody stops smoking. So it's amazing what can be done if you have the willpower. And I have this discussion a lot with my patients about this. So So basically, what we want to point out, fasting during the month of Ramadan can be good for you if it's done correctly, good for your health, obviously good for your iman as well. Do not eat in excess, eat and drink in moderation, obviously, but not excessively. So let's talk about some of the health risks of fasting now before we come on to other aspects. The health risks of fasting can be real and they can be quite serious. So coming on to some of the main aspects, you got obvious ones like dehydration, loss of water, stress. This one I find particularly relevant for me, sleep disruption. I find the most problem for me in Ramadan is actually sleep, because by the time, especially with the long fasting we have, by the time you go to bed, it's 2 o'clock in the morning, 3 o'clock in the morning, you wake up for Fajr, then you go to work at 6 o'clock in the morning, 7 o'clock. So sleep deprivation is actually quite a major factor with the long rosa we have. Headaches, heartburn, and constipation. So certain groups are more at risk. So pre-existing medical conditions, diabetes, which we're going to cover in detail, asthma, COPD, heart failure, chronic kidney disease, acute infections, pregnancy. Having this condition does not mean you cannot fast, but obviously the risks are greater, and that's why it's more important you do it properly. So, obviously, potentially Ramadan this year, we don't know when it's going to be, potentially the 15th of May, long duration of 17 hours plus of fasting. Obviously, since summer is going to be hot, so there'll be increased risk of dehydration, increased risk for certain patients which we covered, and also the change in diet also puts certain patients at risk as well. I'm not going to spend too much time on this. These are some of the impacts of fasting on the body. This PowerPoint, this is being recorded and the PowerPoint is available to people. If anybody wants it, we can email it to you. I'm not going to spend too much time on this slide because it's more academic in nature. Also, there are meant to be some leaflets as well. We were supposed to have some leaflets delivered to us, but there'll be some issue with the postage, but they will be delivered to us later on, and we can, again, if you email us, and if you give the email address, we can send them to you in PDF format. It's not a problem at all. So the Diabetes UK and the Muslim Council of Britain have done some leaflets as well for these things. So coming on to diabetes very briefly, its UK population is 2.9 million diabetics, 22% prevalence of diabetes in the UK, so almost 750,000 people. The Muslim population is 2.9 million, of which probably 750,000 people are probably going to be diabetic, because diabetes is very prevalent in our population. Mainly Pakistani, Indian, Bangladeshi origin, Middle Eastern, Southeast Asian, and the black population. Typically, the studies have shown that fasting in Ramadan by Muslim patients is practiced by 43% of type 1 diabetes, 79% of type 2 diabetes. And obviously, the estimated number of Muslims worldwide with diabetes who fast the whole month of Ramadan is about 50 million, mashallah. So we're not going to spend too much time on this, because just very quickly, type of diabetes, because this is not obviously meant to be intensive health seminar, but there are two types of diabetes. Type 1 diabetes, which need insulin, 10%. Type 2 diabetes, of which the vast majority, 90%, controlled by diet, tablets, insulin and tablets. Diabetes is strongly linked to obesity and overweight. One of the biggest factors, especially type 2 diabetes, and unfortunately it's very common in the Asian community, is being overweight and obese. That's a big factor in diabetes. And there's a very strong correlation between, especially for men, with your waist size. The bigger your waist size is, the much increased chance you have of getting diabetes. So that's a very common problem, unfortunately, in Asian. And that's why, unfortunately, diabetes is more prevalent in the Asian population in the UK than it is in other population groups. Genetic, there are families, if you've got a family history of diabetes, especially, then obviously risk goes up significantly. And as with most things, the risk of diabetes goes up as you get older. Again, we're not going to spend too much time with this, but there are some of the potential complications. This slide is available if people are more interested, but we don't want to make it too academic for people at this stage. So, diabetes complications. Poor diabetic control is linked to high blood pressure, eye disease, kidney failure, heart disease, stroke, nerve damage, and foot amputations. Good term control can prevent these problems. Okay, so let's come on to this quickly. Who is exempt from fasting with regards to diabetes? So these are general schools of thought. So these are some general comments. Again, there'll be some variation with different schools of thought in Islam, but we're putting it out generally there. And if you're not sure, then you must obviously consult your own scholars and so on about that. So children under the age of puberty, the elderly, the sick, chronic and acute illnesses, those with learning difficulties, those who are traveling, pregnant, breastfeeding and menstruating women. And there's obviously a Surah Baqarah. Should any of you be sick or a journey, then you should fast a number of other days equivalent to the missed ones. And as for those who fast with difficulty, they have a choice either to fast or to feed a poor person for every day. So coming on to my bit, last bit, who is exempt? So people with certain conditions are exempt from fasting during Ramadan. High risk of complications if daily food and drink are markedly altered. More than a permission not to fast, God likes his permission to be fulfilled as he likes his will to be executed. And obviously those who cannot fast obviously can give compensation for not fasting. Either fast at a later date if possible, or feed the hungry and poor. Most Muslims with diabetes insist on fasting during Ramadan, and this is what creates an issue for us as physicians and for patients as well. Now there are some further slides near the end of it about other aspects of this as well. So I'll pass on to Osman then, who will do the rest of it. Okay.
My name is I'm one of the cardiology doctors. I'm working in St. George's. We'll go through a few bits now. So there's a few risks associated with diabetes, and I'm not sure if there's many people with diabetes over here. A lot of people are probably very well educated on it. So the main thing obviously is your blood sugar being too low. People probably are very well aware of what the signs are. The most important ones are, for example, you may start feeling dizzy, shaky, irritable. You may start feeling like you're about to lose consciousness, and those are sort of signs you need to be very well aware of. And if you are, you need to obviously take aversive reaction. Evidence has shown that during Ramadan, people who have severe hypoglycemia, which is a low blood sugar, there's about 5 times the increase in risk in type 1 diabetics, and these are the people who are young normally, who will take insulin. And actually in type 2 diabetes, who are the 90% of the population who normally take metformin or other medications, there's actually an 8% almost increase in risk. 8 times, sorry. The other risk in diabetes is your blood sugar being too high. The symptoms you need to be aware of, the diabetics are, you may be more thirsty, start going to the toilet more often, loss of tiredness. And the other thing to be worried about is ketones. Ketones is a medical term that we use, and sometimes diabetics, they may feel like a pear drop smell in the breath, and that may happen in type 1 and sometimes in type 2 diabetics, and that's normally an adverse sign, and you need to be very well aware of that as well. We'll flick through that. Dehydration, you're more likely to be dehydrated because of electrolyte, salts, which are going to be quite different in your body in a diabetic. Then you're more likely to be dehydrated with that. You may be dry mouth, lips and skin. During the month of Ramadan, the diabetics, the most important thing is that you keep your blood sugar under control. What's really important to know is that checking your blood sugar with a glucose meter does not break your fast. So please make sure whoever has diabetes, whether it's yourself or anyone in the family, do not take the risk of not checking it if you have a blood glucose meter. Make sure you look after yourself. And we've gone through some of the complications of long-term poor diabetes, because even though you may not have symptoms now, 10 years down the line, you do not want heart problems, kidney problems. And this is the honest truth, because all of us as doctors, we've seen it. People feel, young ones especially, think they're invincible. 20 years down the line, they have problems. So just to make sure you're preventing all of that. Again, diabetics very well know if the blood sugar is below a level of 4, then you need to end your fast immediately. And this is a general school of thought. So if there's any discrepancies, please feel free to speak to your own sheikh. But if your level is below 4, that from medical terms, that's a dangerous level. And you need to break your fast because your health is at risk. If it's high, there's a general consensus that over 16.7, again, you need to end your fast. You should never stop taking your insulin, and the most important thing is, diabetics, please make your own appointment with the GP at the earliest convenience so you can tailor your insulin. If you're taking your insulin, let's say 3 times a day, or you're taking it once a day, you cannot expect for the next whole month that your health will be the same. What you do not want is to become unwell and being admitted to hospital. So the most important thing, being prepared and seeing your GP for it. To fast or not to fast, I think it's not easy answer. It's a combination of your own religious practices, the medical opinion, and your own decision of the person. So I think I'll leave that up to each and individual person to make that, with the advice of their own sheikh as well. We'll quickly flick through this. Is a very medical heavy slide, but some people may recognize some of these medications. So these, from the medical perspective, we consider the low risk people who are diabetics but not on medications. People who are diabetics and take some of these medications. The most common one people probably notice is metformin, which is what most diabetics are on, but they're considered low risk. The people who are a bit on the borderline are ones where they take medication which lower the blood sugar, which is going to be a glycoside. People also who have not that good a control of diabetes. People who are type 2 diabetic, which is the older people, but they do take insulin. And again, before you start fasting, please make sure you are sensible and take advice either with your GP, or a lot of people have diabetic nurses that they can contact, whichever that may be. The highest risk are the type 1 diabetics. These are the young people who have diabetes most commonly. A lot of people don't actually get awareness of symptoms of hyperglycemia, which is the low blood sugar. Some people may not even, some people are lucky in a way, I think, to feel those dizziness. Some people unfortunately don't. And if you don't have the symptoms, you are probably at high risk. And these are the people, general school of thought is that you should not be fasting. Again, people whose kidneys are not working very well, again, should not be fasting. This is a generally summary slide. I'm sorry that you guys can't see it too well. Again, summarizes the very high risk people. And these are the ones, the general school of thought is that should not be taking risk with their health and perhaps should not fast. And these are the type 1 diabetics, again, the young people. People who've been admitted to hospital frequently with poorly controlled diabetes, or something called DK, which is a medical emergency for the young patients. The middle ground is the high risk ones who possibly should not fast, but again is an individual decision. These are again type 1 diabetics who are good control but are on insulin. People who've again been admitted to hospital and have had a risk of low blood sugar. And the low risk are the ones who can fast are again the type 2 diabetics, older, who are able to keep a good blood sugar control. So the options really are, we'll give you lots of time to have individual questions, but please do visit your GP or speak to another health professional so you are very well aware of what you need to do. If you are advised by your doctor not to fast, then you have to, again, it's your own personal decision, but I would suggest take that advice if it's not right for you. If you are not able to fast and you want further advice, please speak to your local imam. One question a brother asked before was, what should we do if we're not quite sure? It may be a good idea to perhaps try fasting a couple of days before the month of Ramadan in Shaban to see if you are able to complete the fast. See how you get on, and that'll give you a very good idea. This year is going to be very difficult for everyone, especially with the weather. So you need to make sure we all make the right decision. To manage your diabetes, you take your medications regularly. Rigorous exercise is definitely not recommended, especially in diabetics and non-diabetics as well. The sort of food in for sehri, we would recommend sort of wholesome food, high in fiber, moderate meal fare of slow digesting food, so juices and waters. The most important thing is being really well hydrated. That's going to really, really make a big difference. Other foods, for example, your lentils, dal, roti, these help the body feeling, not avoiding it being bloated and tired. And just again, the most important thing is hydration. Try to avoid sugary foods and caffeine, because caffeine is really a diuretic. Diuretic means you take tea or coffee, which a lot of people are used to at the end of your sehri. When you wake up in the morning, you will want to pass urine a lot more. And the thing is, try to avoid taking too large an amount. For iftar, at the end of it, we're all realistic. I'm not going to tell you guys, please stop eating all the things that you enjoy. Have your samosas if you want. But the main thing is, if you're going to have it, if you previously used to have 3 or 4, just cut down the portion size and try to be, rather than having an extra samosa, have something a bit more nutritious as well, rather than completely changing your life. Try, if you can, cut down on deep fried food. Rather than having, again, like I was saying, 2 or 3 portions, have a smaller portion. And try to have a light iftar, especially if you're going tarawih, because all of us understand having a heavy iftar and then going tarawih is normally quite troublesome. Overall, just to finish off, the main message that we're saying is, speak to your either diabetes team or your GP. Make sure you do check your blood sugar if you do have a blood glucose meter, especially if you are diabetic with insulin. It does not break your fast. Be aware that if you feel unwell, if you feel that you are getting those signs of low blood sugar, check your blood sugar, and if it is low, unfortunately, you will have the advice would be just break your fast. You have to look after your health as well. Take some glucose tablets and keep them with you for those adverse symptoms and signs, and always make sure your family or friends are aware if the ones that you're going to be, that you are a diabetic. So if something was to happen, they know exactly what the treatment is. It's a very simple treatment, but if someone was to ever become unwell, very easily fixable rather than not be. Finally, if you are ill, the most important thing is that you do break your fast. Take-home message that's for everyone. We've just talked about the benefits of fasting, weight loss. It does improve cholesterol. Don't eat in excess. It does help people with smoking, and I've seen people who smoke regularly, patients, for the entire month, they don't smoke. So take it as an opportunity to stop smoking or cut down significantly even at the end. And just, I think the most important thing is being prepared for the Ramadan properly, especially this year and the next year when it's going to be very, very hot. So I think the most important thing is looking after your health and your team. Yeah, so just any questions, please feel free to ask both of us. If there's any individual questions, more than happy to answer.
Yeah, please. What sugar meter, when you check it with the meter, what level should be 5.8?
So depends. Firstly, how good the blood sugar control has been in the past. What you want to be is you want to be above 4, because the level below 4 from the medical term is a danger one. That's when you are at risk of becoming unwell, losing consciousness. It's difficult to know, but normally 4 to 12 is a reasonable, but ideally you want 4 to 8. However, it depends on someone's diet. You can't suddenly expect if the normal blood sugar is around 10, you can't suddenly expect their level to be much, much better.
That's a bit after food.
Well, yeah, after food.
It should be what it normally is, whatever your sugar normally is. I mean, you won't suddenly become better diabetic in Ramadan. So if your sugar is normally 9, it should be around 9 to 10, 11. Not much more than 13 to 14.
Yeah.
You want nothing more than you have to be low in sugar. If your sugar is below 4, that's what the most important issue is, I think.
See, when you're fasting, lunchtime I take my medicine in the morning and plus in the evening during lunchtime.
Right.
If I don't take my medicine at lunchtime, does it matter?
Which medication would that be? Is it metformin? Metformin. And do you take it 3 times a day? Or?
Yeah.
Okay. And what dose would you normally take it?
80-50.
Okay. I mean, this will be a general advice because we don't know the rest of your background with regards to, and we won't ask you, of course. Right. What I would say generally, firstly, you should see your GP for it, but there are ways you can have a longer sustained release of the metformin, or it can be that the dose can be adjusted to take in the morning and the afternoon or in the evening. But the most important thing would be you speak to your GP. They may be able to speak to a pharmacist and give you a different type of medication for metformin.
Right. Another thing, what I do normally, I do exercise in the morning, and then also in the afternoon I take a walk.
I think I would avoid exercise in the month of Ramadan.
Sorry?
I would avoid exercise in Ramadan.
Right. Exercise means I do yoga in the morning.
Yeah.
After prayer, so I do for 1.5 hours, yoga every day.
The difficulty is going to be, you may feel fine at that time, but when it comes to 1 o'clock in the afternoon, when the weather's like this,
right,
you normally would be able to get a glass of water. You're not going to be able to. Right. So unfortunately, during that month, I don't know how you feel before Sehri, but I would suggest after Sehri, don't do exercise.
No, but I've been doing it for nearly 10-15 years.
Okay. Even during Ramadan.
Yeah.
So what happened last year when you did it? Did you have problems last year?
I feel nice.
If you feel okay, I mean, ultimately it would be an individual decision. The most important thing is being aware what your own limitations are. Okay. If you feel you can do it, of course, by all means. Okay. But if you feel that it's not something, because what you may be able to do, another person like you may not be able to.
True.
So if you know your body better than we do. True. So if you feel you are able to do it, of course.
Yeah, if you did it last year and you were fine, then probably this year you'll be fine. But if you feel like you're struggling, then you can make a decision yourself.
No, because if I don't do it, I feel like I'm missing something.
Okay.
Yeah, that's fine.
If you've been doing the last 10, 12 years and you feel well with it,
No issue at all with that.
carry on.
Any other questions?
I just got a tip actually just about when you break your fast that you should before you go for Isha you should have gone to the bathroom, and if you haven't drunk enough.
Okay.
Because a lot of people
Yeah.
just associate that they forget to drink.
Yeah.
So that was something I found very helpful with that. You know.
No, thank you. That's actually very useful. Because normally when we are not fasting, recommended daily fluid is about 2 to 3 liters, which most of us probably don't. And during your Ramadan month, it's going to probably even half less than that. So I think that's a really good way.
See, another thing is in this country, like in hot weather countries, people, they have high blood sugar levels, but like in Western countries, because of the coldness weather, so you got low high blood sugar levels. So if you drink like a tea or coffee, because it's got caffeine and nicotine, so is it advisable to drink or no?
So tea and coffee generally are a diuretic. Really what that means is makes you pass urine a lot, makes basically your body dehydrated. During the month of Ramadan, if you are having before, let's say at the end of Saturday, you're having coffee, what will happen is during the rest of the day, you're going to pass lots of urine and you'll become dehydrated.
Sure.
And normally that would happen. So when we normally advise drink to intake, we don't suggest fluids like tea and coffee because it has the opposite effect. So advise you can have it, but I would suggest try to refrain if possible.
Stick to water, right?
Sorry?
Stick to water if you can, as much as you can, plenty of water.
And what about the fizzy drinks or got a diabetic, like, you know?
Again, I think we covered fizzy drinks. Again, if you can avoid them, then you should try to avoid as much as you can. Because also in Ramadan it happens because your stomach is empty, your stomach gets a bit inflamed.
Yeah.
So fizzy drinks have often got obviously increased acid in that.
Yeah.
So if you take a fizzy drink with an inflamed stomach, it increases your chance of getting things like indigestion and heartburn as well. So not only will it put your sugar up, but also increases your chance of getting some stomach irritation, indigestion as well. So if you can avoid it, you try to avoid it.
Okay, so like for example, so if you're diabetic, and normally diabetics they check their blood sugar levels like first thing in the morning before they have their breakfast, and normally they say should be below 7. So in terms of in Ramadan, when are they supposed to check? Is it during the day or when are they supposed to check?
So again, I think that will be very individual. If they normally check it, for example, pre-meal, that would be pre-lunch, pre-evening, pre-dinner. It may be sensible just to, firstly, one person, the most important thing you want to avoid is hypoglycemia, the low blood sugar. If this is someone who knows that they always get symptoms, if they get a low blood sugar, that's an easier thing. They can check it probably 3 times a day, for example, Saturday, sometime midday, and in the evening. However, if it's someone who doesn't get the symptoms, they probably need to check it more frequently. For example, if let's say someone doesn't get symptoms of their blood sugar being too low, perhaps it's sensible when they wake up in the morning before they're going to work, sometime in the afternoon and sometime in the evening. Because I think there's no hard and fast rule on when to check it, but I think it would be...
Just what proportion of type 2 Asian diabetics do you think check their blood sugars?
In my experience, very few.
Very few.
So why we are talking about it is because they don't do it.
Yeah.
So
In my
should we be telling them they must do it? Or not?
I think in Ramadan it's imperative that they must do it.
I think those are the ones who are normally on medications to lower the blood sugar. So medication called metformin does not lower your blood sugar. It's not going to cause hyperglycemia. However, there's a medication we talked about, glycoside, which is the moderate risk, that does cause a low blood sugar.
So is that metformin they don't need to perhaps?
If they don't get symptoms normally, then they probably don't. But the ones who are on medication which lower the blood sugar, they probably should do.
Okay.
Especially the ones...
Even with metformin, they should if they can, ideally.
If they've got a blood glucose meter...
Or they can do the urine check. Nowadays you can also do urine check as well, can't you?
But can we eat present for
Yeah, why not?
So basically they should check if it's like a fast for 17 hours, like it's 17 hours.
Yeah.
They should a patient should check maybe like just after midday, because that's when they probably would have had lunch.
Yeah. Yeah.
So if it's obviously they're missing lunch and
Yeah.
they're missing their lunch.
I think that's quite sensible, actually. What they would normally do, check it at the end.
To check and then see how they.
Yeah, I think that's quite sensible, a good,
Yeah.
very good suggestion as well. Yeah, what they normally would do before they eat a meal, and then they would have an idea what their sugars are like. The most important one is just to try to avoid that hypoglycemia, because all of us who've worked in hospital, we've seen people come in coma, and unfortunately people actually die from a low blood sugar. That's the one thing you have to make sure your family and friends, if they do get symptoms, they're lucky. If they don't get symptoms of low blood sugar, they have to look after their own health very well.
Yeah,
What is the common symptom for low blood sugar?
I think there's a slide on that,
But normally it would be dizziness. You would feel unwell. You may feel blurred vision. That next one, this one.
there we are. So it's pretty much there. Yeah.
But if they've got diabetes for a long period of time, they invariably there'll be some point in their life they would have low blood sugar. So not everyone's going to get all of them. Some people may just get one symptoms. So these are general ones. Whatever, if someone's got diabetes for a long period of time, they will know what symptoms are. But commonly is they'll feel unwell, they'll feel dizzy, or their blurred vision. Those are the most common things.
But again, this is more relevant for people who are insulin, who are taking drugs like gliclazide. Metformin patients who are taking it, they don't tend to get these symptoms because their medicine doesn't reduce their
How
sugar.
about the body weak?
Yeah, you can. That's a general.
That's also normal fasting is when your body feels weak as well. But if you're diabetic, then it may suggest to you should check your sugar. So if you start feeling weak and you're diabetic, then maybe that's indication to you do a quick check of your sugar to see what their levels are. It just gives you a warning sign to think about it. Ultimately, look, if you test your sugar more often, there's no harm to you. It does not invalidate your fast. We said that straight away. Testing sugar does not invalidate your fast. If in doubt and you're diabetic and you're not sure, just check your sugar. I mean, GPs are more than happy about that. If you ask them for extra test strips as well, if you're a GP and you tell them you're diabetic and you're fasting Ramadan and you want to have extra test strips as a precaution, most GPs, they'll be happy to accommodate that. So just tell your GP, I want to have extra test strips because I'm fasting in Ramadan, I'm diabetic, I want to be extra careful. They'll be all very happy to support you. And nobody's going to you know, we're never giving to you.
And the thing is, as all of us get older, our bodies are probably, apart from the young ones, our bodies are probably 1 year less resilient than what they were the year before. So just what you felt like 10 years ago is not going to be what you are like now. So that's being aware.
Definitely not. Yeah.
Definitely not, yeah.
I was just wanting to know, what do you think about exercising in Ramadan? Like maybe some people say do like maybe an hour or half an hour before you break the fast. What do you think about that?
I think if you were to do exercise, that would be the best time to do it. Do it an hour or so before you break the fast, because then you can have your sahari. Don't do it in the middle of the day, I don't think. Because you've got the whole day to get on with it.
Yeah.
But maybe a half an hour before you break your fast, yes. I think you can try to see how you get on. Or you can try to Shaban if there's still some days left for Ramadan. If you exercise regularly, try to do it in Shaban with a couple of fasts and see how we get on.
Is there anything else to control your diabetics if you take like natural remedies? And
Evidence, I mean, in UK, I mean, I know in the Pakistani, Indian, lots of cultures, there's lots of remedies which we don't have evidence for, which work really well. For example, haldi, like it had other health benefits, but at the moment there's no evidence base. From the herbal perspective in the UK, we cannot really, there's nothing that we can advise which is evidence based. But I'm sure there's lots of family members who probably do suggest this. But unfortunately, from the medical perspective, there's nothing that we would be able to recommend. I don't know what your thoughts are, Kashif.
Yeah, as a GP, people often ask me, and I always say to the patient, look, if it's something safe and you feel like it benefits you, then try it, but it should not replace your normal medication. So don't say, I'm going to stop my metformin and take haldi. What you can do is say, okay, I want to try some haldi, or I want to try this. If it's safe and it's a natural ingredient, I'm more than happy to tell my patient, give it a go. Sometimes it's psychological. There's a very strong placebo effect. If somebody tells you something is good for you and you take it, then often the mind is a very, very powerful thing, to be honest.
no, because I've consulted so many GPs, but they always they say, well, what you think like, and it's better for you if you're taking it. Was I don't leave my medicine while carrying on, but it helped me to control my cholesterol and plus my blood sugar levels.
Sure. What it is I think a lot of these, the way we practice medicine and with the way we give medication, it's all based on trials and evidence. There's no trial out there that I'm aware of looking at herbal remedies in this large scale. So there's nothing that a health professional would hand on heart be able to say, we feel confident giving it. We know they do have perceived benefits because families have told us, my dad's told me, my aunties told me, my someone, but we wouldn't be able to say, yes, this is a good alternative.
But why they say like, these things like medicine is made by human, like a human.
Yeah.
But natural remedies is made by Allah.
Yeah, of course.
You see, that got more powerful in that sense.
Of course, a lot of the medications are plant extracts. We use products from there. So they are, of course, it's there'll be so many other things which are herbal. There's so many other things which are not being used, which has probably by far out benefit the medication, but we don't have the evidence at the moment to be able to confidently say, you know what, this is what you should use.
There's no large-scale trials, that's the thing, because there's no trials on healthies. I mean, nobody's done that. So the doctor, I can't say to you, this works because I don't have the evidence for it. It may work, it probably does work, but I can't say that to 100%.
No, but healthy actually got so many other things to cure with, like even cough, you got illness, even cough, which is 50, 60 years old. You can cure it, by taking it, it's got a natural remedy.
Yeah. But you see, as a doctor, we have to look at the evidence.
Yeah.
We can't, but I would never discourage my patient not to try it. It won't do you any harm. It's not going to make things any worse for you. So if it's not going to harm you, by all means, give it a go.
Like, as you're saying, there's a couple of doctors in America, they have approved scientists, in fact, like losing weight or extra fat in your body, you take hot water early in the morning with an empty stomach, it can cure it, or even you've got a big belly, even going to the gym, it doesn't cure it. By taking that water in the morning, warm water,
Yeah, the different cultures. So, for example, the Chinese population, they drink lots of herbal teas, and if you notice, generally their obesity rates are less than whatever the Pakistani ones.
That's right.
Perhaps it's to do with the hot tea, we don't know. Again, but the thing is, we don't have the trial evidence, so we can't say it.
That was very useful. Thank you very much.
Thank you.
Really enjoyed it.
Thank you very much. Thank you for attending. Okay.
Just very quickly, there are a few things we have to put down about what invalidates a fast, what doesn't. This is based on different schools. What is obvious, we've put it down. So acupuncture, for example, it doesn't invalidate it. We talked about blood tests and so on. Brushing your teeth does not invalidate your fast, although there's some different schools of thought on some aspects. So again, if in doubt, obviously consult your imam, your scholar. But there are some things which are a bit of people not sure about. But things like GTN medication for people who've got angina. If you have angina and you have some chest pain, there is no evidence at all that you're allowed to basically take the GTN spray, and it does not invalidate your fast. And we talk about blood tests and so on. Smoking definitely does invalidate your fast. So don't smoke. Please talk about it.
Can I make this?
Yeah, please.
Of course.
I think you should reverse it. If you're in that, consult the doctor, not your imam.
Yeah.
Because the imam is not a doctor.
Yeah.
People ask me a question like that. Should I fast or not? Then ask your doctor. I'm not a doctor.
Yeah.
So and the Quran tell you if you don't fast.
Yeah.
So if you fast when you disappear all of water.
Yeah.
So that's my take on this.
Very sensible.
So please reverse it.
Yeah.
If you feel that, consult your doctor, not your imam.
And if your doctor doesn't know,
for wudu, but not for.
Yeah. No, I think what you're saying is obviously if you're not sure about things like brushing your teeth, for example. I mean, you don't need to consult a doctor for that.
That's my I see what you mean.
Headaches are also common in fasting, headaches.
Yeah. So it's normally, if you are non-diabetic, if you don't have diabetes, normally due to not having enough fluids, mostly. So when you have sehri in the morning, the most important thing, the last thing you should be having is lots of fluids. That's the one thing which will probably make you, lack of it will make you feel unwell. So always have water, lots of water before you're about to finish sehri.
Yeah. There's a very clear correlation between being dehydrated and headaches. That's why I get headaches from Ramadan, because of lack of water. So there's no other way of getting around it.
I know people are fan of tea as well, so I take a lot of time. Is this the cause of not taking caffeine?
So caffeine, unfortunately, is something we call a diuretic, which basically makes you pass more urine. What will happen during the course of the day? You'll probably dehydrate yourself more. So ideally, if you can avoid tea during the month of Ramadan, that's probably ideal, especially for sehri.
Or caffeine free.
Yeah.
Caffeine free. Yeah, if you love the taste, caffeine free is a great alternative. Yeah.
When I fasted, I was so scared of the headache. I took the sehri paracetamol.
Yeah, you can do that.
Yeah.
Well, the fact that paracetamol will not last the whole day. But if you want to take a couple of paracetamol when you with sehri, there's no reason why you can't do that. But as you said, try to cut down on tea. I think you definitely notice the difference if you cut down on your tea. Maybe just have 1 cup if you have to, and have it with your sehri and not with your sahur.
Even taking sugar.
Sorry?
Sugar with the tea.
Any other questions?
No, I really like the idea around having a clever Ramadan diet. That was a really good concept. So thank you for that.
Thank you.
Yes.
Thank you.